guys, welcome back to Medical Coding with Blue. Today's episode is all about medical coding workplace challenges and how to manage them. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a really good comment about this very situation, and so I want to take a whole video to talk about this. So here we go. All right, so the viewer, and thank you to the viewer who posted the comment. The viewer says, "Hi Blue, I want to thank you for this content. I have been certified since 2019 and I'm currently working for a large medical facility. I am experiencing a lot of pushback from our insurance billers and team leads where they will challenge me and my colleague. If anyone has any suggestions on how to handle this, because it is extremely frustrating for someone who is not certified to tell you how to code something, and I'm advising based on coding guidelines and pair guidelines." Okay, so here's the thing. All medical coders, this is the first thing, I'm going to say this first. All medical coders, regardless of credential status or organization that you belong to, all coders who act in the capacity as a medical coder will follow the AHIMA standards of ethical coding. And number 11 stipulates that no coding professional shall engage or support negligent coding practices. Okay, so I'm going to put that out there first. You cannot engage in negligent coding practices. Now, I don't know specifically what is going on with the situation, but I do know that sometimes billers will challenge medical coders, and sometimes a claim will be denied. And then the insurance biller will say, well, it's because the insurance company wants this. And then they'll send it back to the coder. And then the coder will say, no, because this doesn't apply because of X, Y, and Z. Not all claims that get denied by insurance is legitimate, okay? You have to be able to bring your evidence. It is not on the biller who is not a certified medical coder to try to run a medical coder when the medical coder is citing a appropriate guideline, a coding clinic, CPT assistant, something from another official resource. It is not their responsibility. Their responsibility as billers is to bill. That is their responsibility. If they have a message from the insurance company, then they give it on to the medical coder, and then the medical coder will look at it and figure out if it's applicable or not. And if it is, then of course there's, then the process goes on as follows. But if it does not apply, then it is on that medical coder to explain why. It's not on the billers to go back and forth with the coder. And this is where having good leadership to step in to say, no, we're not going to do this. And even with team leads, to say, no, we're not going to have this back and forth thing, especially if somebody who is credentialed. And having a credential says that you have the competence to understand the coding rules and the guidelines, and which is sometimes, of course, people are going to conflict with each other because they don't understand. People who are not certified medical coders often do not understand what we do. There's a lot of misconceptions about medical coders and our responsibilities and our jobs, but our number one thing that we have to do every single time is code ethically. And this protects the patient and ensures quality data from what is happening to them and what procedures they had and things like that. It protects the provider. It protects the integrity of the money that they're getting, and that it is legitimate because according to the codes that were selected by the coder and the procedures, this is what it says. So it is really on the medical coder to shoulder that knowledge on procedures and on diagnoses and on pathophysiology and on all of these things to really get a strong grasp of what is happening with medical coding. Now, I will say this also, not every medical coder, of course, knows everything. Sometimes people who barely start off in the industry know a lot because they study really hard, and sometimes people who have been veterans in the industry, their knowledge tends to go down some because sometimes they get complacent with where they are. They don't challenge themselves. There are some people like that. Then there are some people who will constantly challenge themselves and will constantly push that ball forward as far as knowledge and learning, so that way that when they code, they can be assured that what they're doing is right and just, okay, when it comes to the codes and code selections. So let's put that aside for a second. If a coworker who is not a certified medical coder and doesn't really understand what we do, this does not only apply to team leads, it does not only apply to medical billers, it also refers to the providers that we work with as well, because providers will challenge medical coders, and especially because they think that, oh, you have a high school diploma or a GED and a certification, I don't have to listen to you because I am a surgeon with years of experience and years of schooling. But it is on us to act as a teammate. That is one of our many hats as medical coders, is to be a teammate to our surgeons and providers, and also to the billers, and also to our team leads, and also to other medical coders, because at the end of the day, it is a team effort. And again, if there is not a strong leadership in place, if there is not somebody who has a firm hand to guide people, things can get out of control very easily. And especially when this person is sitting here talking to me about their frustration with these coworkers that are saying all of these things and giving them a lot of pushback, when clearly they're showing that, hey, I'm trying to give you the guidance that I have from Coding Clinic, CPT, and all this other stuff. I have my references and resources. And this is why this is not like this, or this is why I did this, So that's a good step in a good direction. However, I will say this: being in this industry will require you to be able to distinguish what is important and what is not important. And you have to be able to decide what needs your attention and what does not need your attention. Because there's going to be a lot of things that are thrown at you that do not require your attention. I'm going to give you guys an example. I have a coworker who has decided upon herself to make a issue out of something that I do not feel personally that this is an issue, right? And so she sent a mass email to the whole department asking for people to support her with her petition to get this issue addressed. Me personally, it's not coming from my supervisor. I don't have to listen to this. I don't. Because to me, this is unnecessary. It is drama. It is really unwarranted. This issue is very unwarranted. And so I just put it off to the side. I deleted the email and I moved on, because I don't need to get into this mess. It's just essentially what it is. And so I go about and I'm doing my coding thing. This same coworker, a day later, sends a message to myself and a few other people who I guess did not respond to her message, and said, you need to opt in or opt out. And again, I delete the email because I don't have to get involved in this. You are not my supervisor. You don't sign my paycheck. I don't go home with you. So therefore, I don't have to listen to what you're saying. Now, if it was my boss, then yes, I have every responsibility to sit there and respond to whatever she's asking me to do, or whatever she wants me to do. I have to be able to respond. But to another coworker, I do not have to respond, especially on an issue that I do not think personally matters. Okay, so I left it at that. And she sent one more email asking for a response. And again, I didn't say anything. And she finally backed off. Why? Because you don't need my attention. And just like these other insurance billers and the team leads, if they're sending back something and it was coded appropriately, and you send it back and you say, according to this, this, and this was coded appropriately. If the insurance biller comes back and says something else again, you don't have to respond. You've already responded. And my silence to my coworker not responding to her demand for attention on a non-issue, again, it's a response. No response is also a response. And for me doing that, that keeps me out of that fray. That keeps me out of that unnecessary drama. It keeps me focused on what I need to do. It's the same thing with this coder and her coworker, who are clearly trying to do the right thing. Okay. And so in the team lead situation, that if the team lead is pushing you, maybe she didn't say, But if the team lead is pushing for like more production, again, that's not right, because production should only top out to a certain number. All right. When it comes to productivity, and there's going to be a lot of debate about this, some people are going to get upset with me. There's really nothing that I can do. When it comes to productivity, to reasonably look at a record and to be able, and this, I'm talking about outpatient coding, okay? Not inpatient coding, but I'm talking about outpatient coding. Outpatient coding, professional fee coding, that's what I'm talking about. In order to look at a record and reasonably be able to abstract diagnoses or audit diagnosis to make sure that it's actually correct with whatever was selected, because sometimes with these electronic medical records, they will pre-select these diagnoses, these providers will, and then you go in and you make sure if it's correct or not. And if it is incorrect, then you go in and you put the more appropriate code. If they selected the wrong procedure, then of course, then we'll select the appropriate procedure that reflects what is the documentation, what's in there and what it's saying. Doctors are not meant to be medical coders. That is why we have a job, okay? So with that said, if you want to be reasonable on your productivity, a reasonable productivity is anywhere between 80 encounters and 150. 150 is really on the higher side, but that is more for like clinics that are very repetitive and a lot of the same thing over and over again, right? So if you have something like that, then of course the productivity is going to be higher. At my facility, that's the way that it works. The clinics that are more routine and they have a lot of the same thing going on over and over again, their productivity is higher. The clinics that are in like the specialty clinics, like I am in, which is in orthopedics and podiatry, these are considered specialty credentials, specialty. I was thinking about another show I'm going to be doing. They're considered specialty clinics, and with that, these specialty clinics, my productivity is lower. My productivity is 90 average per day, okay? And so anywhere between 80 and 150 is appropriate. When you get into numbers, like somebody commented the last time I did this video, where I was talking about specifically in productivity standards, they were saying that at their facility, they code in the ER and they're expected to code 320 per day. Now, how you manage to do 320 per day without making not a bunch of mistakes, okay, really? So no, 320 a day is ridiculous, especially in something as important as the ER. The ER, you have to be able to code the diagnoses, you have to be able to code to the highest specificity. And there's a lot of injuries when it comes to being seen in the ER. So that's just something that you really ought to consider if you're out there looking for a job and they say, hey, our productivity is 320 per day. Or I did 320 per day, Blue, and I have no problem. Okay, well, I would beg to differ, and I would really ask for an audit at that point, because 320 a day to just pump out and just be like, oh yeah, I never make mistakes, that's not true. Between 80 and 150 is appropriate. So if the team lead is trying to push for, higher, okay. Well, again, you need time to be able to reasonably look through the documentation, reasonably look through everything that is appropriate to look through, and to be able to code. And doing that is not, trying to hit such high numbers like that is just ridiculous, because then at that point, then you're looking at more mistakes, more denials, and then everything just coming back. If they need people to pick up their productivity, if it is a query issue, then that means that the providers need to be educated. If there are excessive queries that have to be done, then you know that those providers are doing the same thing over and over again. So we need somebody to come in there and educate them. Well, no, we don't do that. Somebody said that they didn't like us to do that. It doesn't matter. That is our job. It is part of the ethical standards that we educate and that we promote this industry and promote what we do, and in appropriate ways, in appropriate practices. So that's the thing I'm trying to express to all of you, is that when you are doing something and you know you're doing the right thing, you don't have to have permission to do the right thing. So if it is that your response is like, okay, here's the reason why, this is what I did, you don't have to go back and forth with the coworker. If the team lead is saying, well, your productivity is low, but you're meeting your productivity standards, but they're wanting you to reach these higher levels, but it's not required of you according to what you signed on your standards, then your standards are there. According to my standards, it says that I code 120 average per day. I am currently meeting that standard. Okay, so it's not your fault that they may need to hire more people or they need to, do some more training. That's not your lane, right? Your lane as a medical coder is to code and code appropriately and look for those details and query when it is appropriate. There's no such thing as we can't query. No, you can query, especially if you're working in a clinic. Now, I understand sometimes there's like backlog situations and contract deals. That's something completely different. I'm talking about like if you are in the clinic and that is what you do, and maybe providers have gotten upset before and they don't want somebody to query, and they tend to get a little, loud because, oh, how dare you question me? It's not about questioning the provider's knowledge. It is about asking for clarification to select the appropriate codes, and, making sure that that is clear is a part of your responsibility as a medical coder, to work on that professional communication and to be able to do that. Also knowing that there's going to be times when coworkers are going to go against you. They're going to say things that are hurtful and rude, but you don't have to take it personally, because at the end of the day, the reason that you are there is not about you. It is about the patients. It is about the providers. And when you can focus on that, you're not going to let any of this other riffraff bother you. Now, I can talk about this. I can give you all this advice because in the beginning of my career, when I first got here to my forever home, I did worry about what other people thought and being friendly with my coworkers and stuff. But it was a lot of drama. It was 20 women in one room. And now you want to talk about people trying to get in your lane? There was that all the time. But when I learned that what was my purpose for being there, my purpose for being there wasn't about them. My purpose was for my providers. My purpose was for those patients, that because of me, when they take their record to the next place that they go to, it's going to have the appropriate information in it, because that is so key, especially in the continuity of care type of situation where, you want to make sure that everything that happened with that patient is clear. All of the tests and everything else, the procedures that they had, is clear in the documentation, so that the next person looking at that record can pick up that record and say, okay, it's very clear what happened here. Because I have looked at documentation before that, the provider is new, coming from a different hospital, and they're new to this hospital, and I'm looking at their documentation like, oh my goodness, we have some work to do, because, this is just not clear. And if they don't have a proper teammate to coach them along, because that is how I see myself with my providers. It is, I am their teammate. We work together. I coach them to document appropriately, so that I can be able to get done with routine encounters much faster, so that I have time to concentrate on ones that need a little bit more time. And if you're working with your providers, if you're educating them, guess what? Their documentation is going to be a lot easier and much faster to get through, because you have this open line of communication and you're able to work together, and they're able to document everything that they're supposed to document, so that you can get them all the credit that they need. And this leads you to produce more, and then you're able to look for additional things that you weren't able to slow down before to be able to code out, as far as like, oh, maybe you were just going really fast and you never paid attention to a certain section of the note. You know what I mean? I'm just saying, it's just an example. But the moral of the story is that the better trained your providers are in the documentation, the less conflict there will be when it comes to insurance and billing and denials and all of these things, because it's not going to be ambiguous documentation that is going to go off to the insurance biller, and then the biller's going to send it off and it's going to get denied and it's going to get kicked back, and then here goes with the coder, okay, yeah, it's this, and then they're back and forth, and it should never be back and forth. Once you've explained yourself once, you don't need to keep explaining yourself again and again. And that's the thing people need to understand. We are all adults. When you have already explained yourself, you do not have to explain yourself again and again. If people don't understand, that's their business. That's not your business. You were very clear. And at the end of the day, if this person does not sign your paycheck, if you do not directly report to them, they're not your supervisor, or you do not go home with them, this is not your spouse, your loved one, your partner, you don't have to listen to what they say. Okay? You don't have to listen to what they say. If they're not one of these three people, what they say does not matter. Okay? Especially if you have already shown and proved your point. There is no point in going back and forth, because some people will want to go back and forth with you because they are so convinced that they are right. And when in fact they are wrong. And especially when they don't understand what we do. Now, I have said this many times. I really do believe billers should be required to know a lot more about coding before they get into billing, but that's not an industry standard. But that's just me. I'm just saying. So, the more education that you have, the better off that you are. I am a medical coder. Okay? I am Bleu, the medical coder. And I've been a medical coder for 15 wonderful years. And with this, I will say this. I have learned about surgeries. I don't do surgeries, but I've learned about them. I have learned about billing. I don't do billing. I never have done billing, but I understand billing because I've taken the time to do my research. The same thing with learning about these surgeries, because I want to understand the language. So I encourage people to encourage other people to do the same. If you don't understand why the billers are acting out the way that they are, find out a little bit more about why they have to do what they have to do. And if it's just that they want to do this because they want to do this, no. It is about understanding each other's point of view. Okay? So that's my biggest bit of advice. And again, it goes back to the three. If they do not sign your paycheck, if they are not your direct supervisor, if you do not go home with them, you do not have to listen after you've already made your point. So, with that said, I'm going to go ahead and wrap this one up. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye!